All right, today we're going to take a peek inside the modern physical therapist's toolkit. We're going on a guided tour to sort of demystify all that equipment and explain how these gadgets actually help your body heal. So let's just dive right in. If you've ever been in a treatment room and felt maybe a little intimidated by all the wires and wands and pads, you are definitely not alone. So let's pull back the curtain and see what's really going on with all that tech. First up, we're looking at therapies that harness the power of electricity. Now, I know that sounds intense, but it's really all about using super controlled electrical currents to communicate with your body's nervous system and muscles. And that's the key thing to get here. This isn't some chaotic shock, right? It's a really focused, therapeutic energy that's designed to target very specific issues, from blocking pain signals to waking up muscles. A perfect example of this is electroacupuncture. A therapist will apply a very small, gentle current to acupuncture needles. And the goal is to use that current to directly influence nerve health, boost your blood flow, and get those muscles working correctly again. So how does this actually stop pain? Well, the main idea is something called the gate control theory. Just imagine a gate that pain signals have to pass through to get to your brain. The electrical stimulation from the therapy, it basically rushes to that gate and shuts it, blocking the pain signals from ever getting through. It also helps rebalance your nervous system and can even be used to precisely target muscle motor points to either calm down a muscle that's too active or wake up one that's a bit lazy. So what is this actually used for? Well, the most common reason, of course, is pain relief. But therapists also use it to improve how muscles fire, to correct muscle tone, whether it's too tight or too weak, and even to help break up sticky scar tissue that might be restricting your movement. Okay, now for the really crucial safety check. This is not a treatment for everybody. For example, it should never ever be used near a pacemaker because the current could mess with the device. It's also avoided over areas with blood clots, during pregnancy, or on any areas where you might have numbness or open wounds. Safety always, always comes first. Next up in the toolkit, we're shifting gears from electricity to sound. We're talking about high-frequency sound waves that you can't even hear, but they have these really powerful effects deep inside your body. This is called therapeutic ultrasound, and it's really important to know that this is totally different from the diagnostic ultrasound they use for, say, imaging a baby. This type uses sound waves to create actual physical changes in your tissues, delivering energy to promote healing. The frequency here is everything. It ranges between 0.7 and 3.3 megahertz. Think of it like a focus knob on a camera. By adjusting the frequency, a therapist can control exactly how deep those sound waves travel, letting them target a very specific tissue, whether it's near the surface or deep inside a joint. So, what do these sound waves actually do? Well, they have two main effects. Mechanically, the vibrations act like a micromassage, helping to separate tight fibers and make tissues more flexible. They also create these tiny, rapidly vibrating bubbles that really stimulate the healing process. And then thermally, the sound energy gently heats the deep tissues, which increases blood flow, bringing more oxygen and nutrients to the area to speed up recovery. And just like with electrotherapy, safety is absolutely critical. Ultrasound should not be used during pregnancy, over sensitive areas like your spine, or anywhere near pacemakers. It's also a no-go over things like plastic joint replacements or, and this is an important one, over the growth plates in children, as that energy could affect how their bones develop. All right, the last tools in our tour are ones you've probably used yourself: temperature. We're talking about the simple but incredibly powerful effects of heat and cold, also known as thermotherapy and cryotherapy. So these two are basically opposites. Thermotherapy, or heat, adds energy to the body. This opens up the blood vessels. It's a process called vasodilation, which increases blood flow, relaxes your muscles, and makes tissues more flexible. Cryotherapy, or cold, does the exact opposite. It removes heat, which constricts blood vessels, decreases blood flow, and helps reduce inflammation and swelling. So when is heat the right choice? Well, it's fantastic for chronic pain and stiffness, for relaxing those tight muscle spasms, and for preparing tissues for a good stretch. By boosting blood flow, it just floods the area with oxygen, which can help finally heal those really stubborn, lingering issues. And what about cold? This is your go-to for acute injuries. Think the first 2 or 3 days after you sprain something. Its main job is to control inflammation and swelling. It does this by reducing the metabolic demand of the tissue, basically telling the area to just calm down, which helps manage pain and prevents extra damage from all that swelling. If you've ever put an ice pack on an injury, you've probably felt this exact progression. First comes that intense cold. Then that kind of gives way to a burning or stinging feeling. Then a deep ache sets in. And finally, you get numbness, and that's the pain-relieving stage you're aiming for. But here's maybe the most crucial point. There is a limit. As a rule, never, ever apply cold for more than 20 minutes. Going longer doesn't help more, and you actually risk tissue damage like frostbite. 15 to 20 minutes, that's the sweet spot. So we've looked at electricity, sound, and temperature. But you know what? All of these are just tools. And that brings us to the most important part of any therapy session. Because at the end of the day, it's not the machine that heals you. It's the trained professional who knows which tool to use, at what intensity, and for what specific condition. Their clinical reasoning is what makes these tools effective and, more importantly, safe. So while it's fascinating to know how these tools work, the real takeaway is this. The right treatment is a personalized prescription. It's a decision made by an expert after a thorough assessment. So the next time you see all these machines, you'll know a little more about what they do, and you'll also know that the most important part of the whole equation is the person who's operating them.